Hello, my name is Alfonso Piñeyro, and I am a prosthodontist in the Seattle, Washington area. My expert tip is about implant occlusion. And something that's really important about implant occlusion is understanding that there's been changes in the past few years. When I was doing my training, implant occlusion was a very long and tedious subject, and there used to be all-day lectures on implant occlusion. And it would involve understanding the difference between teeth, periodontal ligaments. Implants don't have periodontal ligaments. Therefore, when you bit down really hard, you should be able to catch shim stock, but when you're biting normally, the patient should just be able to pull the shim stock through. And over the past few years, that's changed, and we've had a better understanding, because something that would happen would be that the patient would come back and the opposing tooth would move, and now you have an uncontrolled occlusion. So the implant occlusion lecture today, if I was going to give one, it would be very simple. It would go something like this. If you have an implant, make sure it has an occlusion. That's it. I could stop the recording right now. But there's important factors that need to be understood. One thing is that still today, many dentists are requesting from their lab having a light occlusion or no occlusion. And that does a few things. First of all, it gives you an unstable occlusion, but it also doesn't allow you to distribute the occlusal forces. Something else that's been in the literature very commonly is the fact that teeth move, implants don't. Therefore, when you have an implant restoration, the tooth mesial to that implant restoration will usually want to drift mesially. Well, that's probably because of a number of factors. However, if we could adjust those teeth and lighten up the excursive contacts, for example, if that mesial tooth had heavy excursive contacts on the mesial marginal ridge, you can lighten up that tooth and adjust that tooth, and maybe even share those excursive contacts with the implant restoration. We know occlusion and bites can move teeth. If we can plan it and adjust it accordingly, we can help prevent that by putting less forces on those teeth. Therefore, potentially have less movement, have less food impaction, have less complications after restoring our implants. So I hope you enjoyed the tip. Thank you very much.